Good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adisuwa Usa-Uwage. Today we're going to be looking at cervical cancer, exactly what this is all about and more you will be learning about today. Joining me to discuss this is the CMD Uniben Medical Service, Chief Medical Director of Uniben Medical Services, yeah? Is that not it?
Chief Medical Officer.
Yes, Chief Medical Officer, sorry. She's the Chief Medical Officer, Uniben Medical Services. Happy to join you, Dr. Toyin Faboya.
Thank you.
I kind of like your name a lot. It's not so common.
Thank you.
All right, and we'd like to know what cervical cancer is.
Thank you. Cervical cancer is the cancer that affects the cervix.
Okay.
That is the neck of the womb inside the female's body.
Okay.
So the cervix is part of the reproductive system of the female.
Okay.
So the cervical cancer affects the cervix in particular.
Of the female.
Yes.
Okay, so what should a woman look out for when it comes to cervical cancer? What are the signs? What are the symptoms? What are the risk factors?
Okay. Some of the signs, you know, cervical cancer don't just develop suddenly like that.
Okay.
It takes time. It can even take up to like 5-10 years.
You don't mean it?
Yes, before it will now transform
Manifest.
to that the cancer cell.
Okay.
So some of the signs, number one, is bleeding per vagina.
Okay.
That's bleeding from the vagina, especially in a woman that has already entered into menopause.
Okay.
So after menopause, that's 12 completed months of not seeing your period, especially at the age of 45 to 55 years.
Okay.
Although it can occur before that 45 and it can also occur after that 55. But average, the average is between 45 to 55.
Okay.
So after entering into menopause, if a woman should not suddenly see blood coming out from the vagina, is a sign that you should go to the hospital and see your doctor. Okay.
Is it only cervical cancer that can cause that condition? Or are there any other thing that can cause that bleeding after menopause?
No, it's not only cervical cancer, but mostly is associated to cervical cancer. Yes.
Okay.
Then also, if you are having that's bleeding after sexual intercourse,
okay,
is also a sign. Then when there's a foul-smelling discharges from the vagina, so it's also a kind of symptoms that the woman can experience. Discharges, maybe bloody, then with foul smelling. Okay. So it's also part of the symptoms. Then such person can develop pelvic pains, especially to the back. Back pain, lower back pain, then the pelvic pain might be a kind of chronic pains. So it can also present in that way. Okay,
you know, a lot of women experience back pain. All right, sometimes I do, depending on my sitting position or if I've been standing for too long. And so there are some women who experience back pain perpetually. Is such a woman supposed to be scared of cervical cancer?
Not really.
Okay.
Because our positioning, just as you rightly said, that your sitting position and things can also affect the back. Then especially our bed. If the bed is soft and there's need for the bed to be changed, if you don't change it on time, you can experience back pain. Or if you have a car and your car seat is not well positioned, it can also affect the back pain. But if a woman is having discharges, for example, the pains, maybe during sexual intercourse, is a reason for such person to go to the clinic, to the hospital, so that it can be screened.
Okay, is there an actual cause of cervical cancer? Can we just put our hands on something to say, okay, this is the cause of cervical cancer?
Yes. There's a virus that is implicated.
Okay.
And the virus is called human papilloma virus.
Okay.
So it's implicated in the cause of cervical cancer. And it's a sexually transmitted virus.
Okay. It's only gotten through sex.
Through sexual
So who's
intercourse.
usually the carrier, the woman or the man?
Both. It can be both of them.
Okay.
It can be both.
Does it manifest in a man? Is it possible for you to see this HPV in a man?
Yes, you can see it by the time you go for the test.
Only then?
You can see it. Also, they can also be having some kind of pains, especially when they are urinating.
Okay.
You know, the urine and the semen, they pass through the same channel.
Okay.
So they can have pains when urinating. So it's very, very important. When a man has pain when urinating, it's a sign that you have to go to the hospital so that you can properly manage.
Okay. And is cervical, I remember when we were on radio, somebody asked if cervical cancer is contagious.
That's through sexual intercourse.
Except you have sex with the person. So sometimes, okay, a woman who's been diagnosed, is it possible for the husband to also have this issue now? Like maybe having discharge and all of that. Is it possible for a man to have all of that?
Yes, it's possible.
It's possible.
Yes.
Okay, now let's look at the, how do we call it now? The testing for cervical cancer.
Okay, good. We have various screening, examination, and test for women.
Okay.
There's one that you can easily get the result within 1 or 2 minutes.
Okay.
And that is called visual inspection with acetic acid.
Okay, visual inspection with acetic acid. Okay.
So we inspect the cervix.
Okay.
We open up the vagina with speculum.
Okay.
And then examine the cervix with some solutions, like that acetic acid.
Okay.
That is diluted 5%.
Okay.
We'll use it to check the cervix. And we are looking for some lesions that can result before the cancer will actually manifest.
Okay.
So we call that pre-cervical cancer lesions.
Okay.
So that can be easily be detected.
Okay.
And once a woman has that, and it can also be easily be treated.
Okay.
So that in 5 to 10 years time, it will not transform or develop into cancer cells.
Oh, that's fantastic. Okay, apart from that, which other way can we? Is it painful? Let me ask, because many of us women, we don't like pains. So is it painful?
It's not really actually painful, but at least you will feel some discomfort when it's being carried out.
Okay. So which other one can we?
Pap smear.
Pap smear. That one is very common.
In fact, this one is common, but the results won't come out till like 2-3 weeks.
Okay, that's
it takes
the pap
time.
smear.
The pap smear takes time. Whereas the visual inspection with acetic acid
is immediate.
Yes, it's immediate. You will get the result. So it's a kind of screening test for a woman that doesn't even have complaint. Okay. It's a screening test that we encourage women to go for.
Okay. All right, we will have the ways you can actually check if you have this cervical cancer, and a way not to get it in 5 to 10 years time. That is if you present early. But the problem is the presenting early of a woman. It's difficult for a woman. Most women, like from the little investigation I did, or should I say survey, or I just did a little research on the number of women that come down with cervical cancer. And I realized that even those who go to the hospital, it's just by chance. Probably the woman went to the hospital for a different ailment, presenting a different condition. And before you know what is happening, they do other tests and then discover that she might be having something relating to cervical cancer or any other cancer for that matter. Most women do not present early. We do not have the culture of going to the hospital when we are ill. We wait for emergency. Like we say it in local parlance, when water don't pass Gary. That's when most women go to the hospital. So how do we encourage women? This is our agenda. We can be very stubborn when it comes to hospital thing. We go to church a lot. We do a lot of spiritual things. And then when it comes to this issue, the first thing we're doing is, it's not my portion. Then whose portion is it?
Nobody.
So how do we push women now to take care of themselves medically? If it's cosmetic, oh no, we're there. But medically, how do we get women to be up and doing? You're a woman, talk to our gender.
That's why the medical women of Edo State chapter comes up with this program, free
Of
screening, free of charge.
We like offer, we like free things.
So that they can come to doctor's house ahead for that screening. So
Free of charge.
Free of charge. So the screening exercise is the avenue that we can easily pick up those that has this cervical cancer.
Okay, now those who are already down with cervical cancer, what is the treatment and management of that ailment that avails them?
It depends.
That are already down.
It depends on the stage.
Okay, how many stages do we have?
I think we have up to like 3, 4. Depending on the stage, that
the person presents.
the person presents. So in some cases, if the person should present early and is still limited to the service or to the reproductive system, so they can easily do hysterectomy. That's they will just remove the womb. They will remove the womb, everything, and the person will be okay. So it will not spread to other parts of the body.
Okay. So what if it has gone everywhere or some other parts of the body? You can understand that cervical cancer can really spread.
Yes. If it has gone, depending too, so there's a radiotherapy, there's chemotherapy that the person can take. But it's better for it to be detected early.
I just hope and pray that my gender will do something to help ourselves medically. When it comes to fashion, when it comes to entertainment, when it comes to looking good and all of that, women are always in the forefront. But when it comes to our health, you see that a lot of women take the back seat because we don't want to spend our money and we are too spiritual. I'm not saying your spirituality will not work for you, but leave what is spiritual to the church and what is medical to the hospital. The other day, a woman was asked to go through CS. She was like, no, it's not a portion, no. Like the Hebrew women. I happened to be in hospital that day, and I asked her a question, are you in a private clinic? I was so upset. I asked her a question, are you a Hebrew woman? No, let's face the fact. Are you a Hebrew woman? You're not even spiritually Hebrew. Not to talk of physically Hebrew. Let them do this CS for you and go. The husband was even saying, let me sign. The woman was saying, don't sign. Our family was saying, don't sign. Nobody in our family had gone through this. She will not start it. It's not our portion. You know that kind of myopic thinking, even in this 21st century. Eventually, she lost the child. She lost the child, and she still had to do that CS to bring that child out. You know, it was painful. Though not related to the woman, I don't even know. I didn't want to see her face so that I don't carry trouble that is not my own, you know. And it was very painful. Women are like that naturally. So we're just hoping and praying that at least you set a day aside, maybe on your birthday, to say every birthday of yours, you will go and do complete medical check. I understand that if you go to government hospital, it's quite cheap.
Yes,
just go and do a comprehensive medical check. Let it be a birthday gift for you. Because from what the doctor said and from what other doctors have said, it does not have signs and symptoms apart from this ones, and this is when it is already manifesting, when it is already getting late. That is when you will see bleeding after menopause, bleeding after sex, foul smell and discharge, and then lower back pain. It is when it has gotten to up to stage 3 or even the last stage that you begin to know that something is happening to you. If you present early, at least you can save yourself. But the issue of hysterectomy is another one, because there are some women who want to give birth, but they are having this issue of cervical cancer. What will be their lot if they remove, because I know hysterectomy is you are removing the womb, there's nothing reproductive in that woman anymore, right? So, and if the woman wants to have kids, what do we do to such a woman?
The woman can adopt or surrogate mother.
You know, surrogacy, some people take this issue of birth very serious.
Okay.
This is Africa. We're still learning. Anyway, your health is more important. Like Dr. Elohos said on the other day, that not be person where they are alive. Go think of Pekin Abi.
Yes, sir.
So it is very important for you as a woman to go to the hospital at least once a year. Do a comprehensive test once a year. There are so many deaths that are needless, that could have been, you know, averted if only you had gone to the hospital early enough. So apart from cervical cancer, what other cancer should a woman be scared of?
Breast cancer.
Breast cancer.
Yes.
That one is serious. I understand that in every 100 women, 10 are usually down with breast cancer.
Yes.
And that's quite huge.
Yes.
So what are the signs and symptoms we should look out for?
First of all, you should know how to examine your breast.
Most of us women don't know how to examine our breasts. So that examination, some may even examine and they will not get it right.
We do teach them at doctor's house.
Okay.
A course of the medical women. So teach them on how to examine their breast, because by the time you know how your breast,
Yes.
when there are changes, you will quickly notice it, and then you will go to the hospital. So there's need for women to know how to examine the breast, at the right time, because of the changes that is going on in our body. If you do it at the wrong time, you will get a wrong message.
A wrong message.
A wrong result.
Okay. So what can a woman do now to help herself, apart from, you know, checking yourself and going to the hospital to do exactly what?
No, by the time you detect any change,
any lump or
maybe
any
lump
change,
or any pain or any discoloration or inward drawing of any part of the breast and so on. So you go to the hospital and see the doctor so that you can be re-examined, and if there's need for further examination or investigation, you will now be asked to do that. Then if you are age 40 and above, at least you should be able to go for mammogram.
Okay.
To check the breast.
Okay.
It's very, very important.
You don't have to be sick before you do that.
No, you don't need to be sick before you go for that, especially when you are at age 40 and above.
All right, Dr. Toyin Farboy. Is it
Farboya?
Farboya.
Yes.
Farboya. I should be able to pronounce that name. I speak Yoruba a lot. So, Dr. Toyin Farboya, this is where I say thank you for finding time to be with us on the program.
You're welcome.
And we're going to call you again so that we'll do something concerning the woman. I'm very particular about a woman's health. Thank you for coming. All right, my gender, let me address us like that. There is need for you to at least once a year do a comprehensive medical check on yourself. Not be for me now, it's for you. On yourself, okay? So that you will be healthy. And once you're healthy, you're wealthy. And then think about your family too. Do something nice for yourself. It's not all about busting some bottles when it comes to your birthday, throwing parties, you know, taking people everywhere. And doing a medical, I was discussing with a woman who said, medical check now for big people. Like that song, just they play. It's not for big people, it's for everybody. And it's cheap if you go to government hospital. Just go there and say you want to do a comprehensive medical check. Let it be the present or the gift that you give to yourself every year. Thank you for watching today's edition of the program, Healthy Living. We'll see you again on Monday. Bye-bye.